So remember that with this cardiac, you need to be able to distinguish what the bulbous cordis is going to form, and so that's on the Facebook page that you have. So the bulbous cordis, you have the proximal, the middle, and distal third, and so the proximal third is going to go on. Your book is different than mine. Oh, here it is. The proximal part is going to form the trabeculated part of the right ventricle. The middle part is going to form this conus cordis. These are these are the outflow tracts of both the right and left ventricle. And then you have the truncus arteriosus that will ultimately form the aorta and the pulmonary trunk. And so so that's the bulbous cordis. Then you have the ventricle, which gives rise to what? The primitive left ventricle. Okay? And then
When you say outflow tract, is it both right and left outflow tracts, or just
from the bulbous? Yes, it's both. Eventually, what happens? You have. I'll get to that, how they separate. Yeah, and then you have the atrium and the sinus venosus, and so the right horn of the sinus venosus is what we're going to talk about next. And the right horn of the sinus venosus will become incorporated into the right atrium, and so that gives rise to the sinus venerum of the right atrium. That's the smooth part, and so that's what gives that. So that right horn does incorporate into the right atrium and expands the right atrium. If you notice, there's a left to right shunt between the horns of the sinus venosus. You have the left sinus horn here, and you'll see it's rather small because you have a left to right shunt. So now you have the coronary sinus arising from the left sinus horn, and on the right side you can see the superior vena cava and inferior vena cava. So there are a couple of statements in your TVL of where the superior and inferior vena cava are derived from, and so just use that as your direct. Your inferior vena cava is from your right vitelline vein and your posterior cardinal vein and its tributaries, and then the superior is from the anterior cardinal vein, okay, and its tributaries. The brachiocephalic, just one more thing, the brachiocephalic vein on the left side arises from an anastomosis between, so if you see here, you have an anterior cardinal vein on the right and left side. This is the right side, left side. There's an anastomosis between those anterior cardinal veins. So the left brachiocephalic vein arises from that anastomosis, and the rest of the left anterior cardinal vein will degenerate, and then that's how that empties into the superior vena cava.
The right and left anterior cardinal veins anastomosis to form the left brachiocephalic vein.
Yeah. So what happens is you have. Do you mind if I just draw in pencil? So you have the anterior cardinal vein on the left side, anterior cardinal vein on the right side. There's a connection between the two, and that's the anastomosis. So this is going to become the left brachiocephalic. It's in the picture here.
picture just out?
Okay.
I'm maybe making it up.
If we're gone too far. In any case, if there's a picture, you can look. So this left brachiocephalic vein is coming from that anastomosis, okay? And then the left anterior cardinal vein degenerates. Then you have the left atrium. You'll have the pulmonary vein as a sprout coming out of the posterior wall of the left atrium, and then that will ultimately, you'll have expansion through the pulmonary veins of the left. Here, you see that little sprout? You'll have expansion of the left atrium through those pulmonary veins.
So what about the vitelline veins?
Yeah, so the vitelline veins the right vitelline vein will come in and form a component of the IVC.
Yes.
Yeah. So do you understand the septum formation?
So yeah,
Yeah.
I think so.
You're okay with that? I can go. Can I get my? I have a diagram that makes it a little.
There's YouTube videos that are posted on our Facebook group.
Oh, I just